Well, you know, one of the chapters has to be your least favorite, right? And this is my least favorite chapter: health insurance, disability income insurance. And why? Mostly because of the politics and the culture that we've created regarding healthcare. It gets very political very quickly. And that's unfortunate because your health is even more important than your finances, right? Yeah. Psst, here are a few words to the wise. Don't get sick. We're going to discuss at various times throughout this presentation the Affordable Care Act. You might know it as Obamacare. And as much bad press as it gets, when you start asking people about it, and they're you don't use the word Obamacare, don't use that term, you find that many Americans wanted it to actually do more than what it did. Very strange, huh? And if you're so inclined, there are numerous links throughout this presentation to read about the healthcare debacle. The healthcare debate that rages unabated in the United States. Slide number 2. How much does it cost for healthcare? Well, the United States has the highest per capita medical expenditures of any industrialized country in the world. And the statistics are about $10,000 per person in 2015. This amount is over twice as much as the average for the 24 industrialized countries in Europe and North America. What? And some studies show that we really don't have that much better health, even though it costs us twice as much. In 1965, the gross domestic product of the United States consisted of 6% medical expenditures. That's about, 1 in 19 or so dollars. In 2004, it had risen to 17.5%. About $1 in $6. And it's still growing. By 2023, they expect it to be fully 19.3%, almost 20%, about $1 in $5 of the money that is spent in the United States will be going to healthcare. And that's why in chapter 1 we said, where are the jobs going to be? Healthcare, healthcare, healthcare. It's a staggering sum. And why is that? Well, I heard an economist say a little quip that I thought was pretty interesting. I don't remember who it was, so I can't put their name down. But he said, Americans want too much of a very good thing. Because the truth is, folks, we have the best healthcare system in the world. And we should say the industrialized world. We should say the industrialized world. And we have the worst healthcare system in the industrialized world. What? How can we have the best and the worst? Well, it's very simple. It's the best if you can afford it or if you have decent health insurance. And it's the worst if you're left out in the cold and it doesn't help you. Oh well, nothing's perfect. Slide number 3. Well, why? Why does it cost so much? Well, there are several reasons. Sophisticated, expensive technologies and duplication of those tests and technologies. Why? If one hospital has the brand new, spanking, fabulous, fantastic machine that costs $1.3 million, all the other hospitals have to have it too. And this is where our system gets criticized by folks outside the United States in the industrialized world, and they say, wait, you have too many hospitals. Here you have 3 hospitals on one corner competing against one another. and hence, exactly. But we say no. We want that competition. We want that competition. We're willing to pay for it. For how long, we don't know. The variety, the frequency of treatments. One drug, right? Exactly, cost $1,000 a pill. You don't believe me, do you? Gilead Sciences, a few years ago. They're not the only ones now. A couple other companies have come up with cures for hepatitis C, which is a pretty serious disease, folks. And if you want hepatitis C, you want to be cured. And before Gilead Sciences came out with their drug, it was not a very pleasant treatment, and it was only about 40% successful. Specifically, you had to spend a year having the worst cold you can imagine. And then after interferon was the drug. And after that year, there's no guarantee that you're cured of hepatitis C. Gilead Sciences, on the other hand, gives you one pill a day for 90 days, and there's a 95% chance you're cured. And if you're not cured, you take it for another 60 days, and there's a 99.99% chance you'll be cured. Every pill was $1,000. They hand deliver the pill to you each day. Right. So, but hepatitis C is something that if you do have, you want to get rid of, because most people who have hepatitis C don't even know it, and it won't hurt. It will never hurt them. They'll go through life and they'll die of something else, or you'll wake up one day with liver cancer and die a very horrible death. High administrative costs. This is a knock against the insurance companies, and they don't like it when we bring this statistic up. But about 1/4 of all those dollars that are going to healthcare are going to the insurance companies. Yeah. And you look at a country like Canada that has socialized medicine. Sorry. And they spend about 1% on the administrative costs. And that's what Medicare spends, another socialized system. So, yes, the insurance companies are getting filthy rich over this. And they'll say we deserve it. And I guess they do. Because if there's an old saying, if you can get somebody to pay you what you're paid, then you deserve it. And then the biggie, we're all getting older. Yep. Which is a good problem to have. I like that problem, but still, it costs. The statistic is from ages 60 to 70, the average person uses more health care resources than they did from ages 0 to 59. And I'm getting there, folks, and I can tell you, yeah, I can see why. Right. I can see why it costs more for us old folks, because there's a lot more things that go wrong. These are the most significant reasons, especially the last two reasons, the administrative costs and the fact that we're just getting older. Malpractice insurance is often used as a scapegoat for spiraling costs, but actually it's a very small amount, except for certain areas of healthcare, such as obstetrics and gynecology, where the doctors pay an enormous amount in malpractice insurance. So there's room for reform there also. Slide number 4. So what's being done? Well, the real answer, as we say at the bottom of the slide, is that there's not much. Are you willing to forego your health care? I don't know that many people who are. Some people are. Some people don't have health insurance. They'll say, well, you know what, I can't really afford it. And then what happens? Right, then they wind up at the emergency room, and it winds up costing 10 times more than it would have if you had gotten it fixed at the beginning. Oh, my goodness. Careful review of fees and charges may help establish incentives for preventative care, because if you can do the services out of the hospital, it's going to cost a whole lot less. Try to get people to take better care of themselves, because preventative care is almost always cheaper than allopathic care, which means once the person is sick. I love the old, traditional ancient Chinese medicine way of paying your doctor. You only paid your doctor when you were healthy. If you were sick, you didn't pay your doctor. You see, it's a different mindset, isn't it? I like that. In other words, you're trying to keep people healthy instead of waiting for them to get sick. And then one thing that's happened is that more and more Americans are doing what are called medical vacations. They're leaving the United States to go abroad and have their surgeries and serious operations and the like, serious treatments outside the United States. Yeah, right. And the insurance company might even offer you, look, we'll send you to South Korea or maybe Mexico or who knows, Brazil or the Philippines, and we'll pay, for a very nice hotel and give you, maybe even give you a few $1,000s to spend to have your gallbladder removed. Why? Because it's going to cost $45,000 in the United States and only $20,000 there. And people say, sure, I'll do that. And other people say, no way. Not me. So you decide. Slide number 5. Which would you choose? You are 34 years old and you've been smoking cigarettes for 20 years. Oh well. Recently, you have been experiencing severe abdominal pain and a nagging cough. You go to your family doctor, who sends you immediately to the hospital. After a few tests, the specialist asks you to sit down with her and tells you that you have stage 4 lung cancer that has spread to your liver and your spine. She tells you probably have 3 to 6 months to live, and she gives you 2 choices. The first choice... What's going on here? Excuse me for a second. The first choice is you decide to forego radical treatment. Instead, you are given pain medication, placed in hospice care after 2 months, and your chances of living 5 years are 1 in 1,000. You die in 4 months. Some people spontaneously get better, but no, very few, most will die. Choice number 2 is you decide to undergo the radical treatment. You have surgery, radiation treatment, several rounds of chemotherapy, and your chance of living 5 years or 1 in 85. You die in 9 months. And folks, it is a horrible, horrible death. If the cancer doesn't kill you, the chemotherapy will. So which choice do you make? And we do this in the face-to-face class, and people's jaws fall down and they have some nervous laughter and they say, oh man, I'd go with number 1. Oh, I don't know, I'll go with number 2. Well, you don't know until you're smacked over the side of the head with a 2x4 with this information. You really don't know how you're going to react. But let's take a look at the financial ramifications. The first choice is going to cost, $50,000 to $100,000. Let's say $75,000. The second choice is going to cost over $1 million, anywhere from $1 million to $1.5 million. Yes, see, you didn't believe me when I told you that every man, woman, and child pays $10,000 to the healthcare industry. But now, do you starting to believe me? Yeah, right. A side note. Within the next 5 years, chemotherapy might be history, folks. The biotechnology companies are working on what's called immunotherapy, and the preliminary results are astounding. People's tumors and cancers disappearing in weeks. Yes, so if you get cancer now, just live as long as you can, okay, folks? And slide number 6. You know what? The cancer is not all that's out there that's costing a tremendous amount of money. Diabetes, folks, die of obesity. There are 200 to 300 million people around the world that have diabetes and they don't even know it. In the United States, we're looking at about $8,000 for the cost of the diabetes care and about $13,500–14,000 for the related healthcare costs. If somebody comes back with post-traumatic stress syndrome from living in an insane world of our choosing, you're looking at $8,000 per year for who knows how many years. Cystic fibrosis, I've seen estimates that go up to $50,000 per year, but the mean average, at least this is what this website says, the National Institute of Health, about $15,500. And if that person requires a lung transplant, $500,000. Oh, I'm sorry, over $500,000. 800,000 for the lung, 500,000 for a liver, $1 million for a heart, and then the anti-rejection medication costs over $20,000 per year for the rest of their life. 1% of all patients use 22% of the medical resources. 5% use 50%. You see why it costs you $10,000 per year per person? 1/3 of all Medicare dollars are spent in the last year of life, just keeping people alive an extra 2 to 3 months. What can we do about these costs? Well, death panels. No, not really, folks. This is indicative of the debate that's going on. People will say it doesn't matter how much it costs. We have to keep people alive no matter what. And other people say, well, it's bankrupting us. We got to do something about this. So this entered into the presidential politics and has been there since, well, it's been there for decades, but it really hit the organic matter really hit the fan when Obama took office. In 2008, while then Senator Obama was campaigning for the presidency and making healthcare his primary focus, at the same time his grandmother was dying, and that was the primary caregiver when he was growing up. So he's running a campaign for president, and he's flying back and forth to Hawaii to see his sick, dying grandmother. He saw the heroic and costly efforts that were being used to keep her alive for the extra few months. And by the way, she was 3 to 4 days shy of seeing him elected president. Pretty wild, huh? Along with his campaign promises to rein in healthcare costs, he floated the idea of giving Medicare patients in the last few months of life information about options such as hospice care, the same decision that we saw a few slides ago. His political opponents quickly accused him of wanting to create death panels. Remember Sarah Palin jumping up and down? And to this day, a large number of people still believe that the Affordable Care Act, aka also known as Obamacare, contains death panels, even though there was never anything in there about deciding who would receive treatment or not. The idea was just to give people options. Politics. Slide number 8. What does politics mean? Poly means many, and ticks are blood-sucking insects. Yes, okay. So let's take a look on slide number 8 at the Affordable Care Act. It's also called Obamacare, and this is where I believe the Democrats were really dumb. They should have called it Romney Care. Why? Because it was originally proposed by the Heritage Foundation, a conservative think tank group, and originally implemented by then Governor Mitt Romney in the state of Massachusetts. Fact, dear students, is always stranger than fiction. In 2012, Mitt Romney had to run against Obama, saying how it was okay for him to implement it, and it was not okay for Obama to implement it. The idea is to create these large health insurance exchanges and increase competition and create a health insurance mandate, encouraging the young and healthy to have insurance to help pay for the older and sicker members of society. people cannot be denied insurance because of pre-existing conditions. So here the insurance companies, they're very powerful, folks, and if they don't want something, they usually shoot it down pretty deftly, pretty artfully. And yet they did not shoot this down because of the pre-existing conditions. Normally that was a non-starter for their negotiations. But because the Affordable Care Act said everybody has to have health insurance, they said, we can live with this. We're going to increase our pool of customers by an extra 20 to 40 million people. So they went along with it. And believe it or not, folks, it's actually worked fairly well in Massachusetts, where 98% of people are now insured. But there are many critics who say, well, that's great for Massachusetts, a highly educated, liberal state, but for much of the rest of the country, no, this is not good. Well, it's an experiment in progress. Will it work on the national level? Well, we're seeing that it's spotty. Sometimes it's working, other places it's not so good. And as we are painfully aware, the news is filled with the cries of the Tea Party Republicans in Congress who will do anything, including shutting down the government and defaulting on the debt, to overturn it. And what will they replace it with? Well, we don't know, but when they get, if they ever do repeal it, what are they going to replace it with? Because this is a serious issue, folks. It has to be, in my humble opinion, beyond partisan politics. Everybody needs a base level of health care. Why? Not because we're doing good for other people, because we're doing good for ourselves. You might think you're safe hiding behind that gated community, but that bacillus tuberculosis bacteria doesn't care one way or the other where you live. Exactly. So healthcare is different than other goods and services. I hear economists say, well, we should treat it like any commodity, but it's not like any commodity. So we'll deal with it. We will have to. As I heard one gentleman, very smart guy, he's a doctor and an investment counselor, who says this: if you designed a system from scratch, you would never create something that we have created over the last several decades. And so it will change. Now, he's not sure how it's going to change. He says anybody who tells you so, the way it's going to be, is either a whole lot smarter than you are, or they're just fooling themselves because of the politics and the economics involved. But we'll see. We'll see. The idea makes sense. You have to have automobile insurance if you drive a car. You have to have homeowners insurance if you own a home. You're breathing, you need health insurance. But we'll see what happens. Slide number 9. How can you reduce your health care costs, your personal health care costs? Well, stay well. Don't get sick. Focus on prevention. Eat a balanced diet and keep your weight under control. Reduce total meat, dairies, and sweets. How much sugar is in soda? And in the face-to-face class, we take a look at this video that shows you how much sugar is in one soda, and it's pretty astounding. It's about 8 to 10 teaspoons of sugar in every soda. We then show another. They're in the chapter 9 section of the website about the real Coca-Cola bears. Coca-Cola is not happy with this video. Learn to deal effectively with stress. Don't smoke. Don't drink to excess. Get enough rest, relaxation, and exercise. If exercise were a pill, and the insurance company, the drug companies are working on this pill, I'm sure. If exercise were a pill, it would be the most prescribed drug in the world. And this is not just an issue with the United States, folks. Around the world, people are getting more sedentary. Cars kill us with kindness, right? Exactly. You need to walk more. And all these advices, all these recommendations, you can just hear your mother telling you, right? Sure, Mom. Yeah, right. So I don't know. That's, I'm not going to jump up and down and scream and holler because I'm sometimes guilty of these things. But no, I do get exercise. We do eat a well balanced diet. We do reduce our sweets consumption. I never drink soda. Never, never, never. Do financial health and medical health have any correlation? Well, the answer is yes. The more wealthy you are in general, the better your medical health, which is why we're teaching you to be wealthy so that you'll be healthy. Okay, slide number 10. Let's get to health insurance and financial planning. And because we spent the first 25 or so minutes just talking about how we can stay healthy and all what's going on with the Affordable Care Act and craziness that's going on, but let's talk about health insurance. Health insurance alleviates the financial burdens people suffer due to illness or injury. Part of your overall risk management plan to safeguard your family's economic security. Because a week in the hospital can literally kill you, folks, financially, and yeah, exactly. In fact, the statistic is that more people are thrown into bankruptcy because of medical bills than anything else. Notwithstanding what goes on with the credit cards. Healthcare costs. 47 million Americans, and that number has gone down somewhat, but that's a sizable portion of the population. And you think, well, it's because they're not hardworking Americans. Well, they are. 2/3 of them are full-time workers and their families. This number has been climbing as more and more smaller businesses claim they can no longer afford the cost of health insurance for the employees. The goal of the Affordable Care Act is to reduce this number to just below about 20 million. So even with the Affordable Care Act, folks, even with Obamacare, Romneycare, we're still looking at 20 million people in the United States without health insurance. It's not the end of the healthcare debate, folks. It's just the beginning. Slide 11. There are many types of healthcare coverages. The one that's often called the Cadillac coverage is the comprehensive major medical insurance. Whether with a low deductible or now more and more a very high deductible, there are other policies that I hope if you are so inclined, read them carefully and see whether it really makes any sense, because most of them are not very good. These hospital indemnity programs where they pay a fixed amount for each day you're in the hospital, well, sure, they're cheap, but they might give you a couple $100 to spend on how you see fit, but what's that worth when you're spending $10,000 a day in the hospital? I don't know. And then many companies push these dread disease, these cancer insurance policies, and they're great if you get the disease that it's covered. But if you don't get that disease, sorry, you're out of luck. And they're not cheap. Aflac is one of the ones that pushes these things, and I, as an insurance agent, I can tell you they pay very good commissions if you sell somebody a cancer policy. And if you get cancer, the policy is very generous. But if you get hepatitis B or hepatitis C or whatever, they don't pay a dime. So I'm not a big fan of these, and I do know that they pay very well commissions. They have very good commissions. Why? Because I'm an insurance agent, so I can tell you the truth. Slide number 12. Dental insurance is not covered in a regular medical plan, so that's separate. And there are some decent plans out there, not too expensive, that I've seen. We have one, actually, we have two at Southwestern, and they're not bad. Vision care, our vision care program, I don't think it's very good if you really need it, because it costs about the same as it's just going to the ophthalmologist once a year and getting a new pair of glasses. So unless you really want very expensive glasses. And then the long-term care insurance was virtually unknown 20, 30 years ago, but now is growing faster than any other form of insurance. Why? Because the baby boomers are seeing their older parents go through their life savings and then become destitute when they enter the nursing care facility. So I believe they're a little oversold, in my humble opinion. If you do especially if you're younger, if you do the things that we discuss in Business 121, build wealth prudently, consistently over time, you'll be self-insured. Because if you wait until you're 60, these things are way too expensive. It depends on how old you are. Of course, the younger you are, the cheaper it's going to be because they have more time to invest the money. Well, you could do that yourself. And my wife is always hammering this. And I say, no, you don't understand. We've done the self-insurance. We've done that on our own. And we're set. But many people are not. And so you need to start early in your investing program. Slide number 13. A good health insurance plan should do what? Well, it should offer hospital and doctor bills and pay at least 80% of the out-of-hospital expenses after the yearly deductible is met. And it should have some kind of stop-loss provision. Limit your out-of-pocket expenses to no more than $4,000 or $5,000 a year. However, I've seen it up now to $6,000, $7,000. Yeah, the stop loss is getting higher. The Affordable Care Act removed the typical $1 million restriction and the typical 1 year pre-existing exclusion for health insurance. Which, again, the insurance companies, they swallowed that to allow to get the fact that everybody had to take insurance. So that was one of the things they agreed to when the Affordable Care Act, Obamacare, was passed in 2010. When Americans are asked if they like the provisions of the Affordable Care Act without naming the law or referring to Obama, they overwhelmingly say yes, they do. But when they're asked if they like Obamacare, they overwhelmingly say no, it's a socialized medicine, government takeover. Oh well, what are you going to do? And what you will notice is that many of the Obamacare exchange insurance plans have very high stop losses, very high deductibles. So they're expecting more and more people to pay more, folks. But could you afford $7,000 a year? I don't know. Everybody's paying 10 grand, folks, if you can believe that. And not everybody collectively, but some people are paying a whole lot more. That's the idea behind insurance. Spread the risk around. Let's continue. Slide number 14. Group plans comprise close to 90% of all health insurance issued. Most are employer-sponsored. And as we said, it's an accident of history, starting back in World War II. No reasonable person would have created it this way, but that's how it shook out. You have some protection if you lose your job. You need not lose your health insurance, but it's not going to be cheap. Individual health insurance policies almost always cost more, but that's supposed to change with the Affordable Care Act health insurance exchanges. We're supposed to create large pools of applicants so that individual policies will have the same buying power, so to speak, as the group policies. As we said, it's an experiment in progress. And then there's managed care. Managed care. And the two prime examples are HMOs and PPOs. So what is an HMO? Health Maintenance Organization. You've heard of Kaiser. It's just one. There are many. You have a gatekeeper. You have to go see your primary care doctor, the gatekeeper, the troll, before you can go see the specialist. The idea is they focus on prevention and wellness. Now, I don't know, folks. They give a lot of lip service to this stuff. They always show you a brochure with an elderly couple on bicycles smiling, and I always say, yeah, how many people drove the SUV from Santee, threw the bikes in the back of the SUV, drove downtown at the harbor, and then rode the bike path 2 miles to Point Loma and back. PPOs are like HMOs, but there's more. There are fewer restrictions and more choices, but it costs more. And if you go to a provider out of the network, it's going to cost even more. Catastrophic health insurance. Now, look, I put that in quotes. We're on slide 16. Not because that's what it's called. I call it that. But it's a low-cost, high-deductible insurance plan. And this is, a lot of the Obamacare affordable exchange plans are like this. You have fairly low cost, but it's not low cost anymore. Where it's all relative. It's still pretty expensive. And you pay pretty much out of pocket for everything until you hit the deductible, which is sometimes $4,000 or $5,000 or more and then hit the stop loss, which may be $7,500. But you get to choose your own healthcare provider. And this gives you the ability to negotiate lower fees. Because when we had, my family, when we had this, because we had the health savings account, the medical savings plan that went with it, we were protected against large losses. And we would talk to our doctors, specialists and the like, and tell them we were paying cash. And we could usually negotiate a 10 to 20% discount. Why? Because the doctors and the health professionals are very happy to get their money that day and not have to deal with the insurance companies. There was one doctor who said, well, sorry, I don't give a discount. And I said, all right, fine. But it got to the point where these things were not cheap anymore, folks. And so it made more sense for us to join the HMO at Southwestern, and we've actually been fairly happy with it. Health savings accounts, used to be medical savings accounts, allow you to put money away pre-tax and then use it to pay for health care costs. So this was an incentive to get people to take control of their medical spending, and they work okay. You want to take a look at them if you're a small business person or you're self-employed, because they can be useful. Now, these are not to be confused with flexible spending accounts, where you through your employer, you have money taken out of your paycheck before you even see it, and then you have to use it for health care. The problem with the FSAs is flexible spending accounts is you have to use them or you lose it. Exactly. So it's not the best system, in my humble opinion. The health savings accounts, you can roll them over from year to year. So I think that makes a whole lot more sense. So take a look at those. If you are self-employed, small business, they might be a good choice for you. Slide number 17, MIB, Men in Black. No. The Medical Information Bureau. Do you remember the super bureaus that were keeping track of your credit history, payment history? Do you remember the LexisNexis that were doing the clue reports from Chapter 8? Well, the same thing is going on with your health history. The Medical Information Bureau operates much in the same manner as the credit reporting agencies. They are used by the life insurance companies in much the same manner as the credit reports and the clue reports are used by the banks and the automobile and homeowners insurance companies. They're protected by the same laws. So you're allowed to get one free report every year, and there's the 800 number and the website. And if there's something wrong, and you want to make sure that there's something wrong, like saying that you have hepatitis B, they have to fix it. They have to do their due diligence, their due research, and a lot of people don't even know this thing exists, including people in the health profession. I was at a doctor's office once where I said, they gave me this agreement to sign about privacy, and I wrote and I said, I want to make sure you don't give this information to MIB. And the woman looked at me and said, oh, wait a minute, sir. She ran in, got the doctor. He came out and said, what is this thing? I don't know what the hell this thing is. You don't know what you're talking about. I said, sir, do you have internet access here? He says, yeah. I said, go back in and type MIB.com and then we'll talk. And he came back and he said, boy, I don't know this thing. He didn't know this thing exists, and he's a doctor. So do make sure that the the Medical Information Bureau knows you and has the right information about you. Okay. Government. Let's take a look at the government healthcare programs. And you never forget, during the healthcare debacle 2010, one of the Congress persons had gone back to his constituencies and was having a town hall meeting, and this made the national news. One guy got up and said, "You keep your government mitts off of my Medicare." Older guy. And the congressman said, "But sir, Medicare is a government program." And the guy, "Don't confuse me with the facts." That's a lot of people. Medicare is for those people 65 or older. You're going to hear people say that Social Security is going bankrupt. No, it's not. Medicare is going bankrupt, and not because it's not an efficient program. There's a lot of waste, there's a lot of fraud. Yes, I agree, but no, the reason it's going bankrupt is because we're living longer. When it was created, people didn't live as long as they live now, and that's what's killing us financially, folks. And we didn't have the $1,000 a pill treatments to give people to. So that's the issue. Part A is compulsory, and that covers the hospital costs. And the Part B are the doctor's office visits, some prescriptions. And it's now what we call means tested. As you earn more money, you pay more. And we'll talk more about this when we get to retirement. The Medicare Advantage is optional, and the Medigap, some people pay. Medicare Advantage is a program that incentivizes the health insurance providers to keep you healthy, like an HMO. And Medigap insurance will often pay for what Medicare does not pay for. So it's similar to the Part C. And then Part D is the prescription costs. If you have high prescription costs, you can join the Part D, and it's a little strange. I think they've streamlined it, but it had what they called the donut hole. So you paid, you got paid they paid for certain things, and then all of a sudden they didn't pay for anything, and then you had to, your cost had to go up substantially before they started paying again. People were not too happy with that. And if you're getting close to 65, you need to talk with the folks at Medicare about this program. If you are indigent, which is a fancy way of saying you don't have any money, there's a program called Medicaid around the country. We call it Medi-Cal in California. This is for low-income people of all ages. It's administered by the states with federal guidelines, and that's was one of the things of the Affordable Care Act, was to expand Medicaid around the country. And some states did it, and with help from the federal government, and other states said, "No, we're not going to do it. You're not going to get involved in our healthcare system." And then the people yelled at them and said, "But why aren't you accepting free money?" "Because of the strings attached." Okay, politics. Slide number 19. Let's turn our attention for a couple of slides to disability income insurance. Because it turns out that disability income insurance is one of the most neglected forms of insurance. Sound like a test question? Yeah. It protects your most valuable asset, your ability to earn an income. People don't think about their ability to earn income as an asset. Wait a minute, that doesn't make sense. Well, yes, it does. If you had a machine in your basement or your garage that was pumping out 40,000 $1 bills every year, would you want it to be insured? Yeah, you would. And so you are that machine pumping out those dollars every year. But the problem is, it's very difficult to find, and if you do find it, it's expensive and restrictive. What a deal. Right. Aim for a benefit that, when added to your other income, will equal about 60%, 70% of your take-home pay. You probably won't find any that exceed 70%. It will only pay if you cannot work at any job. Some policies in the past would say, look, if you can't work at your job, then we'll pay you. No, they want you to get any job. How long do the benefits last? Well, they used to last to 65 when you're retired or for life, but now you're lucky if they last 2 or 3 years to 5 years. What's the waiting period? That's how long you have to wait until the insurance kicks in. So if you say you have an Achilles tendon that has been hurt and you can't even walk, literally do your job, you have to wait 90 days if the 90 days waiting period, or 180 days. So you could think of this like the deductible, right? Remember the deductible? You had to pay $500 before they would, or $1,000 before the insurance company would kick in and start paying. Well, the same thing is true here. You have to wait 90 days, 3 months, or maybe 180 days. And by then your Achilles heel is healed. Your Achilles tendon is okay. You can get up. Yeah, right, folks. The insurance companies are not stupid. They're very, very smart. Yeah. In fact, the typical disability lasts 3 to 6 months. Slide number 20. Where do you get it? Well, some employers do offer good disability policies. We used to have a pretty good one at Southwestern, which yours truly actually paid into, but then they got rid of that, and I haven't looked since at what they offer. Individual disability insurance, as we said, is hard to find, and if you do find it, it's expensive and restrictive. What a deal! And that's part of your assignment. Your assignment is to go out there and find some plans. Find a health insurance plan, find a disability plan. And as I said, it's not easy to find. One of them that still does disability is MetLife. And I don't own any stock in the company. I'm not going to get any commissions or anything. But I just want you to get the quotes. You look at the assignment sheet, and people come back and say, I can't find any. I say, yeah, well, you're not alone. But here, try this company. Social Security has a system that pays, SSI it's called, that if you're totally disabled, lasts for more than 1 year, but the process is so difficult that if you qualify for SSI, by definition, you are not disabled. Figure that one out. Workman's compensation is broke in California, folks, and the governor was going to fix that, Arnold. And he ran into a buzzsaw with his own party, let alone with the Democrats, and didn't get fixed. And I guess Jerry Brown is not too enamored with the idea of trying to fix the workers' compensation program, because the insurance companies and the lawyers are at loggerheads. And I can tell you from personal experience that this system is broken, folks, and we need to reform it, but politics gets in the way. If you're injured at work, the workman's compensation system in California is there to help you. I asked my regular doctor, I said, can't you help me? This is insane. I got to deal with these people. He said, you got to make the system work for you. He just shook his head, said, sorry, it's out of my hands. And I just, well. And by the way, folks, I never missed a day of work. Never missed a day of work when I went through that system. I want to tell you. Slide 21. What's the bottom line on health insurance? Well, right. Bohica, bend over. Comes again. That's right. It's pretty much the bottom line on all insurance. And oh yes, don't forget, don't get sick. Now, in our next presentation, we finish insurance with life insurance. And I really enjoy this as opposed to health insurance, because health insurance is a really sad situation. I really enjoy sticking it to the life insurance companies, because there is a silver lining. There is a joyful outcome for you if you follow the directions carefully. And I'll give you a little precursor. The directions are buy term and invest the difference. See you in our next presentation on life insurance.